Gastroenteritis is a disease that is characterized by stomach illness. It can be categorized into three forms of inflammatory, non-inflammatory, and invasive gastroenteritis. It is caused by a variety of pathogens. The non-inflammatory strains are a result of viruses such as rotavirus, astrovirus, adenovirus, and norovirus, as well as Proteus, Giardia, and Cryptosporidium. Inflammatory gastroenteritis is caused by the bacteria in the Shigella genus, as well as several of the Salmonella strains, and also Entamoeba parasites. Finally, invasive gastroenteritis is caused by bacterial Salmonella typhi and Brucella, and the parasite Entamoeba. There are three categories of gastroenteritis: non-inflammatory, inflammatory, and invasive. All mainly affect the gut with similar symptoms. The most well-known symptoms include vomiting, diarrhea, nausea, increased body temperature, and possible weight loss. This disease can cause fatalities, especially to young children in developing countries. Non-inflammatory, the most common, is characterized by lacking inflammation of the gut, as well as copious amounts of watery stools and vomiting. This is referred to as emesis, with watery diarrhea, and is mainly located in the small intestine. In comparison, inflammatory is where the inflammation of the gut occurs, with stools having leukocytes present. Fever and tenesmus are also common symptoms. This is referred to as dysentery. Thirdly, invasive gastroenteritis, or enteric fever, is the most virulent type and is labelled as such due to how it penetrates the mucosa of the colon. It shares many of the same symptoms with inflammatory, but affects both the colon and ileum. Severe cases of gastroenteritis, if left untreated, can lead to death, although uncommon in developed countries. If it is an extreme case, it can cause severe dehydration, abnormalities in electrolyte concentrations, and malnutrition, which can be fatal. In the majority of cases of gastroenteritis, patients can adequately care for themselves at home through proper rehydration, and admission to hospital can be prevented. Most patients who contract gastroenteritis are able to combat and get over their symptoms in less than 3 days with no treatment necessary. If the case becomes severe, a GP can assess the severity and prescribe medications such as ibuprofen if rest and rehydration is not sufficient. Any medication should only be taken under direct recommendations from a GP, as they could have adverse effects. Ibuprofen in cases has recorded as causing more issues with the individual's stomach. Gastroenteritis becomes an issue when the individual doesn't increase and maintain their hydration. This would be when further tests would take place. Whilst getting rehydrated is the key treatment of gastroenteritis, some medical practitioners feel that the administration of ondansetron is useful also. Doctors that were involved in a fellowship of pediatric emergency medicine 16% of the time administered ondansetron in gastroenteritis patients, whereas doctors that did not receive emergency pediatric fellowships used ondansetron only 9% of the time. The drug is used to slow the feeling of nausea as well as counter vomiting in cancer patients receiving chemotherapy, but can also be helpful for patients with gastroenteritis. As treatment for gastroenteritis is usually to counter the effects and symptoms, water consumption, prevention of electrolyte loss, and rest is vital in allowing for a patient to be able to recover quickly. Dehydration is the most common form of worry for medical practitioners, and therefore if hospitalisation is not seen as necessary, large amounts of water consumption is the least expensive treatment for gastroenteritis. As the client is 10 years of age, it would be recommended to administer ondansetron as well as push for large water consumption. As a younger patient is less mature and experienced when confronted with stressful medical situations, ondansetron would be useful as the more vomiting occurring, the more water is needed to be consumed. If the drug was not useful enough to cause significant slowing of vomiting, it could also act as a placebo for the young patient also.